Hello.
Hello, everybody. I'm Dr. Lenore Walker, and this is brought to you by the American Psychological Association's COVID IPV task force. We're part of an interdivisional task force, a group of psychologists and mental health professionals, and we're here to try to help people deal with the COVID pandemic. We've been doing these roundtables. For a number of months, maybe about 4 or 5 months now. And a number of us jump on every Thursday at 12 noon. You can join us on our Facebook page, COVID IPV. So let me introduce everybody, and then we're going to get on very quickly because we have an excellent program today where we're dealing with substance abuse issues and how to deal with them, not just during COVID, but also during holidays, where we're still, most of us, locked down and having to deal with the holidays in a very different way. So I'm going to introduce some of the people quickly from where they come. We have Dr. Marilyn Safer. She is here from Haifa, Israel. And we have Dr. Eleanor Partis, who is here from Rananan, Israel. So that's exciting. We have Dr. Patricia Villavicencio. She is here from Madrid, Spain. And Dr. Lori Gill, who's going to be one of our presenters today, who's here from Niagara, Canada. Dr. Michaela Mendelson, who's here from Boston, Dr. Eileen Serlin, who's here from San Francisco, and Dr. Lawrence Graber, who is here from San Francisco in the Bay Area, and Dr. Giselle Gaviria, who you met when she introduced us, who's announcing our great virtual dance party. Just a plug giving in for that. That's going to be New Year's Day, New Year's Eve Day, rather, not on the 31st from 12, that's our regular time from 12 to 1. And we're going to have a party to celebrate the end of 2020. And I see it looks like Dr. Eric Pepper. I don't see him, but I see a beautiful scenery. So I'm not quite sure. Maybe he'll jump on later and tell us where he's from. So I think I introduced everybody. Just in case there'll be other people who jump on because we're all busy therapists or doing other work. And so we come on when we can. So let's start. I'm going to turn it over to Dr. Eileen Serlin, who's going to introduce, I think Dr. Graber is going to go first. Am I correct? And then Dr. Gill will follow. So take it away, Dr. Serlin.
Good morning, everybody. Thank you, Dr. Walker. It's a pleasure to be here in this holiday season. Lawrence Graber is a student when I taught at Saybrook University in San Francisco, and I've known him for years and collaborated with him on a number of events. He is a kind of a Renaissance man, besides a psychologist. He's worked in many healthcare settings, in hospitals and so forth. What he brings is a special blend of, he's also a musician, he's a drummer, he's a dancer. So he brings a lot of creativity to whatever he does. I'm sure he will today. Dr. Lori Gill is from Canada. She's been with us on, she's also part of our group. She's been with us on many roundtables, many projects. She also is a Renaissance woman. She has a center for trauma. They work with families. They work with all kinds of issues. Also, with a specialty on embodied approaches, on experiential approaches to working with these issues. So in that way, we hope we're going to complement some of the other presentations. Thanks.
My turn? Hello? No? Is it my turn to start? Okay, hi, I'm Larry. I'm going to present today, and disclaimer, I will be a doctor soon, but I don't yet have my doctorate. Anyway, I'm going to offer a perspective. I want to share screen just so that you can see some things that I prepared.
Go for it.
And is that happening?
No,
Not yet?
not yet.
Is it under?
There you go.
Okay. Okay, so what I'm going to do is I'm going to present something, and hopefully we'll have time to do some of the drawing or even all of the drawing. I'm going to work with you on how to create a personal shield, and this is individual for every kind of a person. And I work with different groups, and I'll be sharing my drum a little later. These motifs that are on Native American drums, you can find thousands of them actually that people have painted, beautiful artwork, and different ones that I looked over that to look at some of the different themes that people can use. However, I've done this with people like decorating an imagery on drums that they have in their minds, that they also are playing in a group that I might be leading. So it sort of depends on you. So I'm going to offer some different options, and you can come up with what works for you best and what might work for a client. And there's some things that I'll add that are trauma related. I'll try and remember, because some things are private that we don't want to put on something and share, but we might want to write them down and have them somewhere where we can then reveal them at our own pace or to whom we want to share them with. So what I'm offering is basically a Jungian and indigenous healing perspective on addictions or substance use disorders, or whatever you want to term that. So the focus is more on personal and transpersonal growth. You can kind of see my screen, right? Rather than symptom control and removal. So the idea is more that the therapy or your recovery process is more like a journey, and not that there's not something broken that needs fixing. So I often think of, I'm also a potter, the Japanese word kinsukuri, is that how you say it, or kintsugi? It's the idea of repairing a broken bowl, and maybe some of you have seen these works of art. And what happens is when they're repaired, gold dust is put into the cement that heals the piece. And the idea is that the bowl's true life really begins when it was dropped. And that the breakage and repair are part of the history. It's sort of the idea that our wounds are as much part of us as our other resources and positive attributes, and they're all make us who we are. So it always makes me think of the Rumi poem that's about where the crack is where the light gets in. And some of you might know the Leonard Cohen song that has that as its major theme. It's a very beautiful song. An Irish writer who some of you might know some of his work, Anam Cara and some other books that he's written, O'Donoghue. I took a quote from him: "To be wholesome, we must be truthful to our vulnerable complexity." So a lot of my work sort of blends the idea of power and vulnerability going together. And one of my motifs, which I think I have on a shield that I did that you can't probably see very well, it's fading, that I did in a workshop once with a teacher that works with Native Americans. One of my motifs is the horse archetype, which is a symbol of non-predatory power, and also the symbol of fierceness and gentleness, or courage and vulnerability, and how those things blend together, how to be strong and empathetic. A lot of themes that I think we need a lot more in the world right now. In any case, so I think of therapy as a heroic journey. And when thinking about substance use, I think of it energetically. What is the energy that's calling you in that addiction or in that substance use? That something actually important is happening, rather than trying to control it and get rid of it, or it's okay to manage. And I mean, the caveat or disclaimer is everything that the client is already doing that works, I want them to continue doing, but I'm just offering a perspective. And so what I'm trying to do is nurture that part of the person that maybe needs some expression, and that somehow the addiction isn't quite getting it to where it can go, or it might even be diluting the energy that needs to move that forward into something more productive and more whole for them. So I put some questions down. what is if the substance abuse is calling to you, what is it? Is there a location in your body where that calling might be coming from? What can it teach me? I often think of, like, with working with trauma, and addiction is similar in some ways. What are the attempts to heal that's in the symptoms or the disorder? For instance, cutters are often trying to control their own pain rather than having somebody else be giving it to them. And there's often a lot of themes around blood that connect to being able to let out emotion or to control the flow of my own pain in titrating, which is often something we want to do when working with trauma, is help people feel a little bit at a time rather than be overwhelmed. So an indigenous healing perspective, which is a bit different than a biomedical perspective, is looking more at connection and holism, and that mind, body, spirit, and nature are unified. And so the themes are always around the illness is some sort of imbalance in the totality of our being, including our connection with the natural world, which is also the connection with how the natural world seems to work, which is in circles and in cycles and in flows. So healing is about balance, and it is also often active. So there's something you might be doing, like a ritual or creativity or telling stories. And there is this notion that there are intrusions from the outside, that there are some sort of forces or things in my life, or toxicities or toxic people, or things that are depleting myself in some sort of essential way, depleting my spirituality, what's considered a soul wounding in Native American cultures. In Chinese medicine, I almost became an acupuncturist. And one of the things that I found was interesting, that alcoholism is considered as a disorder of passion. And the idea was there was an imbalance in your passion, sort of what nourishes you for life. What is your life sustenance? And so there's sort of this looking at, what is my passion? Have I lost it? Can I get it back? Do I need to find a new one? How do I cultivate that passion in a way? And what is my addiction or substance use? How is it possibly distracting or diluting or keeping me from actualizing that passion into my life? Okay. So the whole idea, I'm going to kind of skip over some of this. I think I already mentioned this. The focus isn't about getting rid of the problem in a sense, but rather about building bridges. And I'll work with this theme in the shield work. When I thought about addictions, I tried to come up with something more related. I haven't really been in the front lines for a while, but thinking of triggers as bridges, as triggers as things that are sort of cues to what I might do differently, or how I might reframe something that's toxic into something that can be useful for me. Part of the process of, like, creating something with artwork or making a shield, something that's symbolic and that reminds you of things about yourself and the world and how you engage the world, is an ability to use dissociation to put something outside of yourself, or to create a distance, or to shift a perspective that actually, in a sense, physically does that, but also spatially, and involves some sort of activity rather than it being just sort of things that are stuck inside your mind. Whereas dissociation is kind of a common thing in trauma and in addictions, ways when we're becoming sort of automatons, or just doing things without really having agency, or to numb feelings or get disconnected from the body, different ways to sort of solve problems that we don't have agency towards, and we don't have our own regulation of it. So I think I put in this, the eagle eye perspective is sort of, how do I get something at a distance so I can look at a bigger picture. Let's see, most indigenous traditions hold potent metaphors that depict our wounds as access points. I remember when my flute teacher was demonstrating the Native American flute, and she said the holes in the flutes invoke how psychospiritual wounds can be conduits to a new song. Okay, so the base, the sort of the core of the shield work is protection, purification, and empowerment. And the idea that a shield is not a wall, it's not keeping things out in a fixed way, but it's a way to become more flexible or have a flexible boundary. It's movable. The goal is sort of to work towards some sort of wholeness where I feel myself, where I occupy my space in a more self-affirming way, and I can engage the world more flexibly. My drum, this is one drum that I use with clients and I use in circles or with groups, has a sun buffalo motive. And it has kind of a loud resonance if you can hear it. One of the ways that I've used this drum with clients, and that I like the idea of having a drum as a shield, is that you can move it around and it resonates both towards you and it also resonates out towards the world. So when you make the connection with the things that you want to honor yourself with, that those you can feel resonating towards you, and then the ways that you want to create space or give distance so that you can engage in a safe way with the world and in a way that's productive, or if you want to actually move things out of your field, this vibration can really sort of create that resonance. So one of the things about a shield is the circle, and that's a sacred symbol in Native American cultures and in many cultures. A circle has infinite sides, infinite angles. It has no beginning and no end. So there's this idea that things will go in continuation. And that theme is pretty important, especially in trauma work, the sense that what's happening now can move through a cycle and it can come to another place, and there'll be opportunities to do things over and over again, and you don't have to be stuck right where you are. Not sure what else I put on in here. Well, the buffalo medicine symbolizes life. The buffalo is the sun buffalo image. It sort of resonates to the sun dance, which is a very important religious ceremony that was outlawed and then is now again legal in Canada and the US, and I'm sure throughout the world. It's a sacred ceremony one of the things that's interesting about it is for renewal. It involves sacrifice, if people know about it. But one of the things that is empowering about that ceremony that I learned more recently is that when the boys and men sacrifice by feeling pain in their own flesh, they're also honoring women for the sacrifices that they give in childbirth and other things. And I think that's kind of a nice aspect of it. One of the things that's nice about me using this drum is that I can teach a client how to stand and be rooted and feel their strength, and how to strike a drum where it produces sound easily, because the drum head actually allows things to bounce off it. So you're not just hitting it in a way that doesn't really have any power. And so I kind of teach the person how to have strength while still being, I don't know, in a way fluid or delicate. How am I doing? So we should get to this is just sort of some pieces that go into the shield. But I have another thing that's sort of a ways to transform criticisms. There's a lot of stuff here that I don't, if we're going to get to work on something, I won't have time to go over. But I could create handouts.
That would be great. That would be absolutely great. Some
Yeah,
of
because
these,
I also have this handout, and you can't see the whole thing, but this kind of aligns it, and then I made a simpler drawing that I
huh.
didn't need to work on. But part of the idea with the shield, let me see if I missed something where I was introducing it. That's okay.
Larry, just a
Yeah,
few more minutes.
a few more minutes.
Yes.
Oh, okay. All right. So the idea with the shield, and you could maybe see that as well, is that you put your resources on the inside of the shield. And this is this one that I drew is a great example, because, but I like that you maybe add color and that you try and make the boundary something kind of pretty or colorful or rainbowish. Is that on the inside you put strengths and resources. And these can be like qualities that you have, and also symbols. These can be like animals that you connect with. It could be pets or animals in the wild or nature, a tree. I would put like a snake-like river, because that has like a spiral connection underneath, something that's self-organizing. Positive activities that you do, personal qualities like you're kind, you're courageous, any kinds of forms of support, like I cans. I was thinking of things like, I just have maybe an heirloom from your family or some object that you kept that feels good to you. And always put a challenge in there, the wounds or the cracks, something that you've gone through that's been a hardship. The outside of the circle, what you put on the outside of the circle are sort of the things that are triggers or things that stress you out or intrusive, criticisms, toxic people, expectations. I thought about, for sobriety, it might be some of the things having to do with like the acronym like HALT. And then sort of the ideas is that you start to transform some of these things. So if there's a criticism out there that like you're lazy, you might have something that's more affirmative, like I know my own rhythm and body. I know when I need to rest, recharge myself, not be pushed by other people's expectation and views. So I know I'm running out of time. So what are the things that I write down? So the inside are your like supports, your resources, skills, personal qualities, values, affirmations, symbols, animals, nature, colors, objects, heirlooms. The outside are stressors, toxic stuff, triggers, critical stuff. And I like to consider the outside as like the underdeveloped protectors. And in trauma, this is important. There might be critics that are telling you to hurry up or to not trust or other kinds of themes. And these might be just like underdeveloped parts of yourself that are trying to protect you. But maybe you can do a better job of that now as you start to nurture yourself in other ways that give you more options. So that's sort of a quickie on all that. With drugs and alcohol, I would maybe, think about these themes. Sometimes if I'm working with a client, it's going to be like just core feelings, like I'm valuable, like filling in blanks. I'm a good person. My feelings matter. My space, mine. These very sort of solid things. I can speak up for myself. And they can be things directed at the outside. Back off. You don't define me. I'm not your punching bag. Things like this. And then it's really good to always have a part that has to do with what you want to share. So you would have that in the inside and you would sort of pronounce it. And then the other idea, which doesn't look like I'll have time, is that this is all about balance and flexibility and integration. So at some point, you can look at like how do you thank the intrusions? How do you thank the parts that bother you? How do you thank them and start to sort out what's useful and what you don't need any longer? And how to thank them for getting you through hard times when you were younger, or hard times even now. And then just to round it off, some of the ways to like work when it has to do with trauma and pacing is that some of these things can be private. Like you can have a piece of paper for things that you don't want to show everybody or right away, and like fold in the corners and put those things inside there. And then you can open them up only when you want to, or open up one at a time, and then Scotch tape that maybe to it. In terms of artwork and stuff, you can draw on the shield, or you could take stuff off the internet, like images, and then paste it on and create your own. As far as a process, this can be a process that you get in touch with that's silent. You know, one of my hypnosis mentors does something with pushing away and holding to you, so you get in touch at the same time. I can hold the distance, what isn't good for me, and then bring what is good for me to me. When working with a client with any of these things, you want to make, and maybe Lori's going to go over this, that they're connected with their bodies. So if they're feeling something, if they're trying to make a statement, like back off, feel your back right now. Just take some time and take a breath. Feel the rhythm that's right with you. Okay, is that it?
Yeah.
Okay. All
Thank
right.
you.
Well, I hope this is useful, and I can create some of these handouts and people can download them or something. Right?
Yeah, absolutely. Absolutely. They'll be on our website for sure.
Okay.
We put in as an attachment or as an image or a photo, as well as some information that you have for yourself.
Okay. So I'll create some little PDFs or something like that.
Thank you.
Yeah, maybe we can, if you have them now, maybe we can attach, there may be a way to put it on the chat. I'm not quite sure.
Or send them to me, Larry, directly. I can actually
Okay.
either on the
Giselle? Is that
web,
Giselle?
either on the Facebook, or I can put in there too as well.
Okay.
I think we're going to want, to have Larry back, because I've got a zillion questions.
Yeah, I know this was a lot
and
in a short amount of time.
But next time we're going to give you the full hour. And
Okay, because I really like to get to the part where you move ahead into the future, where some of these things are working out better, and you get an image of how you got there, and some of the more integrated parts. Okay.
Thanks. That's really, really, really interesting. Okay, Lori, we'll let you take it away.
All right.
And take what that time you need, and then we'll go into discussion mode.
Okay, sounds good. Thanks so much, Larry. That was great. It's very similar to what you were describing. Well, I run a trauma-specific treatment center, and we very much treat the underlying issue, right?
So we not, yes, screen
Yeah.
share.
Oh, I have to take off. Did you take them off?
All right. Are you hearing me okay?
Yes,
Okay.
Lori.
All right. So we do treat the underlying issues, but with compassion and kindness, right? Rather than treating the symptoms that result, there are adaptations that are survival driven that we recognize arise out of people's experiences. And when looking at addictions, quite often people just want it to stop, right? They want the cutting to stop, or the self-harming behavior, or the high-risk behavior to stop, or the addiction behavior to stop, but it's served a purpose. And I think what we want to be mindful of is that expecting this to stop without filling whatever is needed there or building competencies can actually be really dangerous. So when I'm working with people, we work through the affect regulation lens. We're looking at that window of tolerance and really understanding, what is that addiction doing? So for example, when we see people stuck on with excess energy, right, they tend to be gravitating towards substances which are bringing that arousal down. If they go too low down, they might use a stimulant to level out. If we see people feeling really shut down, emotionally dead inside, they might be gravitating towards a stimulant, right? But if they go too high up, they might use a depressant to level it out. What they're doing without even knowing it is trying to bring themselves back into this more regulated affective state. So part of our work always looks at, how can we use the body to discharge excess energy? It might be shaking it out, stomping it out, bouncing it out, dancing it out, singing it out, right? But doing something to move that excess energy out of the body, or to stimulate when we're shut down, right? So upregulating when I feel lethargic or exhausted. And I really like Tara Brach's analogy of true versus false refuges. So when I talk about addictions, a false refuge is something that gives that illusion of helping, right? And when I worked as an addictions therapist for years, we would play this through quite often to the end. So there's this illusion and this excitatory response in the brain that pairs with the addictions, and gives the message that it's going to help, right? And I'm going to feel better. But really what we know is the underlying issue that's caused the pull towards the addiction behavior is still there afterwards. In fact, it's not resolved and often is amplified because we have things like shame and guilt and powerlessness that have added on there. Plus, whatever we've done while we were using or drinking, maybe we've spent money, maybe we ended up using and we didn't want to, or we ate a bunch of stuff, or behaved in a way that we didn't want to behave. So it tends to actually have an amplifying negative effect. And when we play that through and really see the impact, it's a detriment rather than a benefit. And that's why I call it a bit of an illusion. Whereas something that is a true refuge is something that we do that is in alignment with ourself, our values, our goal for ourselves, and it feels good, right? It actually is moving us forward on our healing journey. I often invite people to just consider, right? A lot of times these adaptations were needed at one time. They were the only perhaps tools that we had during a difficult time in our life. But as we grow competencies and we become more embodied and we learn what we need and what we want and what we don't want, much like the activity Larry was talking about is great for that self-discovery work, we can start bringing more of that into our life and start pushing away the things that are no longer serving us. And I often will ask, this was needed at one point in time. Is it still needed now? And we can do some resource installation and really work on some of those neural networks of association that are formed. So what I'd like to do is just take you through two little exercises. One of them is based on sensory distraction. So this will not be an unfamiliar exercise for most of you. But what we know is quite often when people are using or drinking, there's a sensory impulse, right? And this becomes very subconscious. Many people will say to me, I don't even remember going to get the alcohol, or I don't even remember going to get the drugs. Next thing you know, I'm just using. But it starts with some kind of sensory impulse. And what people will often describe is this loneliness or, abandonment or isolation. So we have this feeling or sensation. What we want to do is try to disrupt that for a moment. A moment is 1 to 2 seconds, right? So I love the concept of drumming that Larry talked about. I often start with smell because smell is the fastest way to the thinking brain or the prefrontal part of the brain. So if I'm working with somebody and they've got this anomalous thought process where part of them is pushing away the addiction and part of them is drawn towards it, that can be really hard, but we want to kind of tease apart what is my intended outcome, and is what I'm about to do bringing me closer to that intended outcome or further away from it. So sensory distraction can be a great way to override those impulses. So it might be a smell. Essential oils are great for this. It might be a taste, something that has a strong taste, but you're not maybe going to want to eat like candy. So I think of candied ginger, for example. I'll take that when I get a tummy ache or a lemon or something like that. I had a client once that used candied cinnamon hearts to overcome a heroin addiction. Now, somebody might say, well, candy's bad and it's not good for you, but it's harm reduction. It's going to be a lot less lethal than using hard substances, right? So it's finding something that disrupts that urge to use. And maybe it's singing, maybe it's drumming, maybe it's dancing, maybe it's considering, you know, what needs to be nourished when this is coming up? What message can I offer myself? What resources can I tap into visually, emotionally, spiritually? We know that brain research shows us when we imagine ourselves doing something, the neurons in the brain are activated as though we are actually doing this. So one of my favorite activities is using resource installation to really create those new neural pathways, new neural networks of association, and embody them. I like to use bilateral stimulation because I find what it does is it brings it from up here, into the body. So all I'm going to invite you to do is think about, you know, qualities, characteristics, traits of your inner wisdom, right? You can write some of those words down if you'd like. You can pop them into the chat box, but they'll be a little bit different for everyone. But just really taking a moment to consider when you think of inner wisdom or wisdom in general, what words, qualities, characteristics, traits represent this? What does that look like? Take just a moment to think about that. And then at your own pace, because everybody's different, so I'll just give you the rest of the instructions. At your own pace, I would just invite you to tap it in. And it doesn't have to be up here, it's just easier to demonstrate, but one hand then the other. It's that bilateral stimulation for as long as it feels good while focusing on those qualities of inner wisdom, really just embodying. What does that mean? What does that look like? What is my posture, tone of voice, body, right? What does that look like and feel like? Just coming back to the room whenever you're ready, just noticing, right? How did that feel for you? Anyone comfortable sharing? Just noticing.
I found a rhythm, and I eventually got this message that I can be in rhythm with people in the world around me and with myself, and there's a flow. And that got to a really nice place eventually. At first it just kind of was with me, and then it
Beautiful.
grew.
Yeah, beautiful. Thank you. Yeah, Eileen.
It was equanimity.
Mm,
I
yeah.
really felt like a mountain.
Yeah.
Like
Oh,
like a mountain. Yeah.
that's wonderful. And that's what I love about it is it often will deepen, right? When we can get out of that thinking part of our brain. A lot of times the first time we try it, it feels uncomfortable or unusual. And I'm wondering, am I doing it right? And there is no right or wrong. And a lot of people don't like tapping up here because it feels like a hug. You can tap on your legs, you can tap your feet, you can drum on a drum, but we want to try with one, then the other. I'm just going to add on to that with one other activity and then we'll open it up for discussion. But the other piece that I really love to do from an addictions perspective is considering how would I like to respond, right? So I often ask clients, is this moving you forward or keeping you stuck? Is it helpful or hurtful? Is it bringing you towards that intended outcome or further away from it? How would you like to see yourself responding in this situation? And this ties in with future visualization. So what I'll do is I'll actually have them imagine tapping into that inner wisdom, you know, using that guidance to help inform their decisions after they've used sensory distraction to access, you know, that higher order part of their brain, and really just visualize themselves in the future, naming it, right? I know where this is. I understand where this comes from. This was a pattern that was needed at one point in time. However, I now have other tools, skills, resources, strategies that I can use, and seeing themselves respond in a different way. So again, when that feels solid, when I have a concept in my mind and a message that goes with that, then I would invite them to tap that in for as long as it feels good for them. What this does is it gives a new association for the brain to draw from, right? So a lot of this is based on Laurel Parnell's resource installation work from the attachment focused EMDR, but I find it works so incredibly powerfully for helping give new templates of association for past patterns of behavior. And the last thing that I'll say is, with addictions, change is hard with anything. Changes in patterns are hard. And I think giving permission to be kind to self, to explore with compassionate curiosity, to notice that just because there's a lapse, it doesn't mean it's a relapse, right? It doesn't mean we have to lose the skills, tools, qualities that we've acquired, but we can refocus and recenter on where am I headed? What is that intended outcome? And really focusing on embodying and, settling into that as much as we can will really help redirect the actions as well as the neurochemistry and the physiology that's being activated in our body. So thank you for having me. I hope that's helpful. And you can adapt that so many different ways, like strength or other things. So thanks.
Wow. I
Right.
wish we had so much more time. We have about 10 minutes for us to all jump in. So why don't we share some of our feelings about what we've just explored and talk a little bit about it. Eileen, I see you're ready.
Well, I want to thank, first of all, Larry and Lori, and
Yes.
just a little frame around this, and everybody for listening. From our committee, which is whole person, we really work with mind, body, spirit. Our belief is that trauma is often in the body. It's been called unspeakable terror, overwhelming terror. We do want to get to, I know, Lenore, you talked about the importance of naming in words, but pre-verbal, often you're not there yet. So these experiential ways evoke emotion, help titrate emotions, things that don't even yet have words, until finally you're able to speak and share and name it and dialogue with it. So because trauma is so much in the body, we really feel that these kinds of exercises and processes that we do help move it, or move from stuck to something much more constructive, and also to naming and verbal and sharing and dialoguing, and then the cognitive parts of the brain as well. And then integrating all of that, as hopefully some of it demonstrated, the integration of the verbal, the nonverbal, and the whole person in here. So that's our framing today.
I like to think of it being a spiral, that we're
Mhm.
constantly going in and out of the verbal and the pre-verbal in order to do the kind of integration. Because I think we tend to think we move off one thing and then we get to another, but I don't see, especially with addictions, I see it more. I don't think it's sequential. I think it goes back and forth in that kind of spiral way. I don't know.
I think that's important, that people don't always think of a spiral as that a spiral goes back and then it goes forward a little different. There's this progression and then this return. And it's a beautiful, me coming from a rhythm perspective, I like what Lori brought up about the sort of disruption and repair. How do you recognize how there are lows and highs and how they're all part of one gestalt? That you're not just in one place, that you might have something that's like a relapse or a slip or a dip or something, and how do you keep, how does that turn into something that goes back up?
Well, I know, Larry, your
Connect.
image of the spiral, which is your email address, I mean, it's
Yeah.
central to your work, is that because I often get people who say, oh, I'm back where I started. Well, the idea of a spiral is it seems like you're back, but actually you're in another higher level of integration. So you're actually moving. So one of the things I think it's important to encounter in people is this despair that I've fallen off the way. I'm back. I may as well give up and stop trying again. No,
Yeah,
you're
you have to remember
still moving.
what you've already been through and how you've gotten up before, or that you can always something new can always be the next thing.
Part of the journey. Yeah.
I think so much of cognitive therapy focuses on the problems that people have rather than on the strengths. And I like the approach that both of you were using, is to really look at internalizing those strengths, coming to understand them. I think the shield, I want to know more about it because I think it has a lot of good potential. Never having used it, but
And
dabbled in some of it.
one more comment about that, Lenore, which is, as Larry said, that the what we consider the problems or the weaknesses are often doorways into the strengths. So it's really reframing the vulnerabilities, not trying to fix them or eliminate them, but it's the turning point of how do you find to turn the problem into something constructive.
Right. Marilyn, I see you're
I
ready.
actually,
Eric.
changing the topic, Lori asked, to talk about, our experience in doing this. I sort of all of a sudden had the feeling it was really very nice, and somehow I realized that one of the things of being on my own now is missing the closeness of people that I care about, not even people that I'm in a physical relationship, but being in the room, being close to someone, somehow I'm missing, I was
Well, I
doing
think
something that gave me a personal feeling that I've been missing during this being locked down and isolated so much.
And
I think
thanks
touch
for sharing
does that, but we can touch ourselves.
Yeah,
touch, but also the tapping, right?
That's
Because
what
you
this
can
is.
visualize the loved ones that you can't be with.
Right.
And what we understand is the brain doesn't differentiate between somebody being with us and them actually, us visualizing that. The thinking part of the brain does, but I often say if you can invite that to scoot and just be in the body, it is amazing. It is amazing how powerful that can feel. Right. And I do that around my grandma all the time. She passed years ago. And when I really miss her, I'll just close my eyes and I'll, visualize her scent and being wrapped up in a hug, and I'll tap that in and I feel it. Every part of my being feels it. So I think it is a great resource right now when we are isolated.
Eleanor, may I?
Yeah, I would like to add, thank you for the range of practical tools and accessing resources. Coming from an attachment perspective, I think, neuroscience has a good basis for what you're offering. And some people, especially those with attachment insecurity, may find the soft and gentle and feminine imagery threatening. So those people might actually, the images that come from protective shields, energy bubbles, Star Wars, Enterprise, the power, the shield, that could be an answer for those people who might find it very difficult to cope with because of the fear of compassion, to feel vulnerable when in touch with that compassion. Thank you. It was amazing, both presentations.
Thank you. Eric, you had something to say?
Just a couple. I think it's great.
Right, Eric.
I mean, and I love the using this. In many ways, if I think about it, both the sound or the touching are great ways both to purely interrupt our automatic thinking patterns. It stops it without giving the instruction trying to stop, and that to me is a major theme. The two other pieces that I'm asking, any of you, if any, neither Larry and Laura, you have any sense for whom touch, is there a difference for some people that touch is more powerful, or sound, or together? Because people are all different. And the final one was a comment is, to what extent do you ever use, which you do in many Native American traditions, you use smells or others, but taste and smell are primary conditioning cues. And we as therapists, I think people often forget that, and they could include this in their office or giving clients, as once you have done the ritual, give them their smudge pot, or give them their certain smell they can now take home to re-evoke it without words.
Yeah,
Um,
sure. I mean, go ahead, Lori.
Oh, sorry. I was just going to say, we incorporate all of that into our sessions. So we have essential oils, we have diffusers, we have smudge, not smudging, sage, Palo Santo wood, drums, music. So we regularly incorporate that into the work that we do. And to your other questions, we have things like Scotch mints as well, or different flavored teas. So we really try to use all of the senses to help people with grounding as well as nurturing, right? And figuring out what is good and comfortable for them. And I'll just add one more thing and then turn things over to Larry. But to Eleanor's point as well, part of the reason we focus on the qualities is because there's a distancing. And if I'm working with someone with attachment trauma, I might not say inner wisdom, I'll say the qualities and characteristics of a wise figure. And then we're not focusing on that person being wise to them, right? We're just installing the qualities. So there's a little bit of a safeness that comes with that distancing. So yeah, but thanks, Eric and Eleanor, and Larry, I'll be quiet so you can chime in.
I just would share a couple of things as far as the touch goes. I teach self-touch. There's a difference, though, I've also noticed between self-touch and striking a drum. Some people really can get into striking a drum. I do also use like a more warrior, like those pool noodles. I can have a person have a drum and a sword, so they can move things away and they can get into the more macho-y sort of vibration. But there's other things I do that have more to do with those vital energies that involve like acting like a gorilla and different things, but playful sorts of things. But also in terms of that, what you were saying, Lori, about the qualities, it's always unique for a different person. But I know for myself, I get very playful and I like to show that I'm kind of absurd. And so if I can make fun of something and qualities and things, I can introduce an idea that it lives in a transpersonal space. The wisdom is a wisdom being, but Larry is this silly person that says weird things. So I just kind of go with it, so it depends on what the therapist is comfortable and how they deliver, but sometimes you create a certain atmosphere where clients will take in things they might not ordinarily follow.
I want to say something. I just want to give us, because I think I'm understanding what people are saying, but as somebody who really works with a lot of people who have been battered and abused, and people who have touched them in ways that they have not asked for, we have, I think, to be very careful about how we use touch. In many of the women I work with, particularly women, I spend a lot of time having them sometimes just put a little cream on their hand and touch their hand. Anything more than that may be too much for them, because the body remembers the touch. And I think, as Lori says, you don't differentiate often who does it, but we have to use that touch very slowly, knowing who we're working with, and produce it slowly. And just one other thing, and I know we all want to talk. I'm very careful if I'm working with somebody who does not have good control of their anger to use bats and pool things and striking things, without also making sure their cognitive, what's going on cognitively is calm and not rising the anger. So the two together, as I think you were talking about, Larry, I think is critical to be able to do that. We can't do it separately, or you're going to end up with, at least where there's domestic violence.
Lenore,
Yeah, well,
I just wanted to add to that too, that, for the therapists watching this is not a cookbook. Don't go out and apply these techniques or feel like you have to master the whole range. Exactly. I think one of the bottom lines is there's no one size fits all. You really have to use your clinical judgment. What we're adding is creativity. if you want to try introducing a smell, see how it works. Use your own repertoire of things you can do. Take the principles from here, not feel like you have to go out and start buying drums and do everything that was presented today. So use good clinical judgment and just expand your repertoire a little bit, trying some of these techniques if you like.
Patricia, did you want to say something before we have to end? You're muted.
Somebody gonna?
Sorry.
Yeah.
Clinical judgment, but I will say common sense also.
Yes.
We never, please don't, even patients, anyone, it's your common sense. Even if your therapist is asking you to do something and you don't feel like it, please share that with your therapist. And because we are humans and sometimes we're clinical judgments, it's based on information or assessment that you as a patient, maybe you have not shared. For example, when Lenore, you said cream, it came to me the experiences of childhood abuse. And cream might be close to ejaculation and abuse, for children.
Excellent. Excellent.
So that's one thing. Or, we need to do a very, very thorough assessment. And sometimes even when we do that as clinicians, you get surprised when a patient tells you, I was ashamed of sharing this with you. And it takes so long for patients to share things that they get embarrassed and they feel they can't share this. It's not because of you. Maybe it's because of us as therapists, right? We need to
We have to
analyze
be
it.
willing. We have to be willing to try. I like the notion of courage to try different things and to
Yeah.
be able to say, not quite working. Maybe we try something else.
Yeah, and so we need to tell, go through, ask our patients for if it's okay for them to try, and it's okay for them, especially for abuse victims, and they are eager to please their therapist because they have been taught.
Yes.
They learn this to survive. So we need to be very cautious of recommendations and when they follow them, how they feel, and well, we need to be attuned every session to what's working or what's not working, right?
Really glad you're speaking up. Always at the end of a talk, when I give one, I'd like to have a page that sort of has some safety guidelines.
That's great.
Because there's so much that's important about pacing and about the intent, and that the therapist really feels like the client doesn't need to do anything in particular. Whatever your idea is, they don't have to do it. They need to know that they have a choice, and that's a tricky line to negotiate.
Timing is everything in treatment. Lori, did you want to say something? And then we're going to have to.
Just one more thing. Yeah, I know. And then we'll wrap it up. I think touching on everything that you guys have all said, I agree. I think use of voice, autonomy, choice, all of that is so critical, especially for trauma populations. But I also think when we are able to experience something, so when we're introducing, for example, gentle touch or something nurturing, we do want to notice, right, that emotional felt state. And this is we're always trying to do integrative work at our center. So we want to notice that emotional felt state, but also consciously becoming aware of, okay, I've just applied this lotion. I offered this to myself. How did that feel? What do I notice? Was that okay? Did anything bad happen when I did that? So we want to be integrative in the sense of bringing that reflection in as well, so that that's going to stick with us, because the brain hyperattunes to the threat. So it's going to remember the threat of, oh my gosh, I was asked to do something overwhelming and scary, but it's not necessarily going to remember the outcome of having felt empowered or nurtured or, you know, good. And the only other thing I'll add as a little plug, and I hope it's okay, is as Eileen was saying, I think training is important in the work. We do offer training and certification in our integrative trauma and attachment treatment model. And this is what we do, is really teach people how to process through trauma in a safe, structured, embodied way, but also take in, you know, the senses and use the body and fear reframing messages. And there are lots of good trainings out there to help with that. Creative therapies, dance and movement. So if it's something you're interested in learning more about, there are so many things out there, and people are doing a lot of webinars right now. So explore it, right? Like Eileen said, if you're drawn to something, learn, research, find out what's out there, and grow your repertoire a little bit, because this stuff is so critical for trauma, because we know that that thinking part of the brain, the speech, you know, centers are largely offline. So we need to be starting with the body to then engage the higher order parts of the brain.
I think we're done, but yeah, I really ditto the training part. If you're going to work with people with expressive stuff, I consider the therapist that the therapist's role is to help regulate, help the client to regulate. So the therapist needs to know if that client's going too quickly, that you can help them to take it back and to feel themselves stronger, to move in a different rhythm, to try it slower first before you go faster. There's just so much that training cues you to, that you can be there for your client, because it's a little different than just talking. Things can happen quickly, and so the therapist needs to be able to be responsive and present and facilitate and regulate with the client. That's
This
all.
is great. I hate to end it. I want to keep going.
Well,
but
again, it's like great to meet you, Lenore. Really great.
It's great to work with all of you. I can't tell you how warm and wonderful it's been to have these two groups collaborating together. Eleanor last week, who shared so much with us, and Larry, you today. Lori, we count as one of ours, even though she's also one of yours. So we love her and have
Right.
worked with her forever, and so pleased that we can do. We're enriching our repertoire, and it only is good for our clients, for our friends, for ourselves, this kind of enrichment. So with that, I am going to do the bad job of pulling the plug and ending us. Next week, even though it's right before the Christmas holiday, for those of you who celebrate, take an hour out of your time and spend it with us on Thursday from 12 to 1 Eastern time, or whatever time. I love the fact that we're all over the world, so it's different time zones for you. Take that hour and spend it with us. It's going to be worthwhile. And for those of you who are watching this on video, remember that we've got over 500 people who watch our videos that are posted on our COVID IPV Facebook page and on Instagram. Patricia helps us with Instagram, and I don't see Rita and Brittany, some of our other people. They may have had to jump off because of other responsibilities. They often stay in the background and don't show their faces, but they're essential to the work that we do, because they are the social media savvy people, as well as Lori, who's been great making us pretty. See you all. Have a very nice holiday for those who we don't see next week, and we'll see you again soon. Bye for
Thank
all.
you so much, Lori and Lawrence, for
Yes,
your
yes.
For the
presentation.
New Year's dance party.
Yes, come to the New Year's
Yes.
Day.
New Year's dance
Party 2 weeks.
Yes.
Thanks,
Bring
everybody.
in a better year.
Eileen's gonna be our DJ.
Yeah,
We're here to bring in a better year.
Yes.
Yep.
yes.
Yes, please.
Thank you.
Everyone.